Mr. Cervenka, you asked for a chance to redirect. You have 1 minute.
The first testifier, Ms. Doctor, asked for an assurance from the department about our processing of the exemptions. When we realized, as she brought to our attention, a couple examples where it was incorrectly denied, we went back through every single denial that we had made and corrected all of those, and I do believe that it's been corrected going forward. I would, of course, encourage anybody that discovers where we need to continue to make corrections. We are committed to doing that.
Very good.
So I wanted to provide that assurance on the record.
Let's continue on the ISSS conversation. Issue 6, restoration of the ISSS 7%. I'm sorry, we had a question from one of our committee members, Mr. Harper.
Thank you very much, Mr. Chairman. Just a few questions. I know you touched on this a little bit, but I want to make sure to ask the question directly so I can get a more comprehensive answer. What planning did the Department of Social Services do while this issue was in the court system?
What planning did we do while it was in the court system? So the bulk of the planning had been done in the run-up to January 1, 2015 implementation. There was a significant amount of development of county forms, revised timesheets, training, etc. When the court action at the very end of December, just a few days before implementation occurred, we had no idea when the court process might exhaust. When it became apparent in August and it's still unclear, I might add, whether the Supreme Court will actually take up this case, but implementation is proceeding. There's no injunction. When it became clear in August, we began again to refresh all of those things that we did. We had to update the timesheet again. We had to refresh the training. We had a good collection of lessons learned, and we had great collaboration from labor organizations and our county partners in what worked and didn't work in the prior run-up that enabled us to do what we consider a very good training effort for this time. There was a lot of forms being developed. The list goes on. The policy goes on. And we don't know everything up front. Sometimes as we move through implementation, we're learning as we go. Instructions continue to be issued and refined. There are a lot of what-if scenarios. We have long lists of questions that are being developed into frequently asked questions document to answer individual unique circumstances. So there's really a lot of work that has gone into this. I didn't overstate in my opening remark when I said this is one of the more complicated things we've ever done.
Question?
Yeah. Additional question is, why weren't each of the all-county letters distributed during the grace period?
Well, some were issued before the grace period, and some were issued during the grace period. And part of that is because in the conversations with stakeholders that contribute to the drafting of those and then the stakeholder review process of those, and admittedly in some cases rather short review periods, but we collected a lot of input. There's a lot of iterative back and forth on the development in each and every one of those. And then additionally, some are less time critical than others. A dispute process for a violation, we're not assessing during the grace period violations. We won't know the first violation would have occurred until the end of the May pay period, so the first week in June. And as mentioned by some of your testifiers, we've addressed that administratively. So the first disputes, for example, wouldn't be known now until the end of the month of June or first week in July. So the need to issue in March, perhaps, guidance on how to handle that dispute process, that's not necessarily helpful, although people like to know what's expected. But we think, as we issued it yesterday, that that's more timely for folks to begin to understand and be able to train staff.
Does this answer the member's question?
You know.
Yeah, and my third question builds on this is, do you think that it's acceptable to be releasing regulations piecemeal in this fashion and expect providers to be able to comply with incomplete regulations?
So we think the rules for providers have been really clear. We started doing the mass mailings back in October to providers. We admit that it's complex and it can be confusing, but those regulations on the weekly caps began with work week agreements, and there's been a very iterative process for those work week agreements where we have providers serving multiple consumers or a consumer with multiple providers, in assisting the scheduling of those to avoid the very timesheet errors that we're talking about, but most importantly to ensure that recipient services are there. I would say in any regulation there's a balancing act between volume and complexity. There are a number of discrete topics for which we've issued all-county letters in this area, and we've also gotten complaints on the flip side that 33-page ACLs, 60-page ACLs, ACLs with 22 forms attached. Some have already told us that's too much even in small packages. So we're doing the best we can to implement a very complicated program change. We have the big picture in mind as we're issuing these pieces. We have a roadmap for those pieces, and we are adjusting as we learn as we go along, as indicated, for example, again, by that program manager letter issued just yesterday evening in response to understanding that it's still confusing and folks need more time to be trained on those rules.
And the final question I have is that if the Department of Healthcare Services can delay implementation because the IT system wasn't ready, why can't the DSS give county social workers and IHSS providers more time to comply with these regulations?
Yeah, so I think there's a misunderstanding. The basic premise of the question was that the Department of Healthcare Services is not implementing. They are implementing. They have a very small provider pool to deal with on this issue, and they are able to address it manually until it's fully automated in the September software update to the system. So it's a very different scenario than we have. And again, we have had the month. We've had the 3-month grace period, and now again in May we've administratively addressed that issue as well. So we are doing the best we can to balance the training needs of counties, but overall, completely. Our goal has always been to maintain the ability of a recipient to receive all of their authorized services. That's our paramount concern in this implementation.
Thank you, Mr. Chairman. That concludes my 4 questions.
Thank you. Thank you. Continuing on IHSS issues, number 6, restoration of the IHSS 7% across the board reduction. Continuing with the Department of Social Services, if you could just give us the briefest framing of the issue so that we can take questions from the committee and public comment.
Sure. Pete Chervenka again with the department. In the current year's budget, the budget that was enacted for this year, general fund was used on a one-time basis to restore the 7% reduction that had been in place as a result of budget measures. The administration has been very clear that that restoration is linked to enactment and effectiveness of the managed care organization tax that the legislature approved in special session. And the trailer bill before the committee with the May revision links the 7% restoration to the effectiveness of that MCO tax pending federal approval. So we want to make sure that the revenue generated by the tax remains available to fund the restoration.
From the Department of Finance?
Yang Lee with Department of Finance. I just want to know that I believe the federal government just approved the tax this morning. So,
Right. News to me. Yes. Good.
From the LEO's office? Public comment?
Thank you. Seriously.
Deborah Doctor, Disability Rights California. We urge the committee to take action to de-link the restoration from the MCO tax, to which it is not actually related. It's not that the funds from the MCO tax are being used for this, and to tie this to a tax which expires, and there's doubt, there's always uncertainty, is to continue having this sword hanging over the head of IHSS consumers, and we urge you to take action to repeal this 7% cut. Thank you.
Thank you.
Kim Rutledge with I need to get a little closer. Kim Rutledge with UDW AFSCME. While we really appreciate the fact that the MCO funds are going to fund the restoration for the next 3 years, we would really like to see this permanently restored using any means necessary, and we urge this committee to continue to adopt the language that they voted on back in March to go ahead and restore the 7% cut using the general fund. So, Thank you.
Thank you.
Tiffany White with SEIU California. I will just echo the comments made by Kim, and we support the actions that were taken by this committee on March 9th to repeal the cuts completely. Thank you.
Thank you.
Rain Hicks, California's Disability Rights. We agree. We're glad for the MCO tax for having it happening and everything. But the concern is that what happens down the road, further down the road, they get these services and then they're going to have service cuts. That's not fair to the consumers, but it's also not fair to everybody else who works with the consumer. So for us, we agree with Deborah Doctor's comments on this. Thank you.
Thank you.
All right, I'm Nancy Tilcock. I'm a member of CARA. I'm a retired teacher. I'm also a good friend of UDW, and I think we need to listen very closely to all of Deborah's remarks. Thank you.
Thank you. We're going to move on to issue number 7. It's the Universal Assessment Tool, continuing with the Department of Social Services.
Very, very briefly, the governor's budget included more money for the universal assessment than we think we can spend. Then in the May revision, we've asked that the amount included in the budget for next year become $500,000 for development of the universal assessment tool. The universal assessment tool was required by the same legislation that enacted the Coordinated Care Initiative in 7 California counties. The development of this tool has been proceeding through a contract with the University of California, Los Angeles, and a variety of stakeholder convenings. The goal of this tool is to look at not just primary care, but in-home preventive services. The basis for the tool is the existing IHSS assessment, but the ultimate goal is to include preventive care and other types of needs in a single assessment tool. We are working on the development of this. Needless to say, it's complicated and it's slow going. It's very important to do it right. We are always dismayed when there's a delay, but we believe doing it right is more important than the time frame on this one. The draft schedule is included in your agenda here.
Let's hear from Finance.
Yeah,
Thank you.
Thank you.
Anything from the LEO's office?
Thank you, Mr. Chair. We would just note that the downward budget adjustment included in the May revision is consistent with our understanding of where they are with the delays in the implementation.
Thank you. Committee questions? Any public comment? Seeing no public comment, thank you for that. We'll move on to issue 8, cost of living adjustment for state supplementary payment program. Continuing with the department, just a brief overview.
I can be very brief on this one. This proposal for May revision is exactly the same as the proposal in the governor's budget. We were proposing a CNI adjustment, California Necessities Adjustment, to the SSP portion of the SSI-SSP grant. The only change from the governor's budget is that the updated COLA factor or CNI factor is now 0.2 percentage points lower than it was at the governor's budget. Of note and potential interest to the committee as well, although we do not budget federal funds for the SSI-SSP grant program, the federal COLA previously estimated at the governor's budget to be 1.7% applied to the SSI amount is now estimated to be 0 in the budget year. So they're not part of our budget, but of interest.
Thank you. From Finance? LEO's office?
Thank you, Mr. Chair. We would just note that the revision to the California Necessities Index is consistent with our understanding we reviewed, and we were expecting this in January.
Thank you. Committee questions? Public comment?
Mike Carroll with the Western Center on Law and Poverty. We're certainly appreciative of the first increase of the SSP portion of the grant in 10 years. The last one we had was 2006. And unfortunately, however, at this rate, with this low of an increase, we're never going to get back the $77 a month that we've cut from those grants. We have to do more. And we would encourage this committee as we go through the process in the next several weeks of figuring out exactly how it is over several years, we restore that entire $77 to get people back above the federal poverty level where we've put almost 1 million SSI recipients. Thank you.
Deborah Doctor, Disability Rights California. I'd like to support what Mike Harrell just said and just add that while it's true that there's no place like home, and it's nice to see the governor supporting that concept, there is no home if you can't afford to live on your SSI. Thank you.
Thank you.
Yeah, Kevin Asnian, Coalition California Welfare Rights Organizations, ditto.
Thank you.
Brian Hicks, California's Disability Rights and SSI, SSP consumer. And I can tell you, this $77, if I wasn't living with my partner and had his income and our income together, I couldn't live where I am now. I couldn't eat. I have a friend of mine who's actually has to borrow money from his parents. He has to go and get food from food closets. He has to go and borrow food from his parents. He's in really bad shape. And with the rents going up as it is, personally, I don't even think $77 would cover an increase that we really need for people to be able to subsist and live on SSI, SSP. So this, we thank the governor for even talking about this and looking into this proposal. And we support the $77 increase, total restoration, and probably an increase that goes down the road. Because, you know, just because we're done with the recession doesn't mean we're not going to have inflation. And rents keep going up, especially as they start building around in this neighborhood and this area.
Thank you. Moving on to issue number 9, CalWORKS October 2016 maximum aid payment increase. Continuing with the Department of Social Services, if you could just brief overview.
The first sentence in your agenda says everything. There's adequate revenue in the realignment sub-account to provide a 1.43% grant increase effective October 1, 2016. That's the May revision proposal.
Thank you. Finance from the LAO's office.
Thank you, Mr. Chair. Ryan Woolsey with the LAO. Like the department mentioned, this is really more of an update to estimates than a proposal. And as is noted in the agenda, the committee did take action to use the revenues that would fund this 1.4% increase to pay for a 4% increase and the cost of the repeal of the maximum family grant policy in the CalWORKS program.
Thank you. Any public comment? And could we move the microphone to the center aisle, please? Any public comment on this issue? Public comment? Sorry, we faked you out. You moved over there? We got you here.
Thank you, Mr. Chair. Mike Carroll again with the Western Center on Law and Poverty. Again, we're appreciative of the governor coming out in the May revise with this proposal. You know, obviously CalWORKS grants are, you know, sub-deep poverty at this point. We really want to see them increased. Having said that, however, we really concur with the analysis that your committee staff has prepared, which is that we hope that this can be considered within the context of the proposal that this committee has already adopted for the repeal of the maximum family grant and a 4% grant increase for all CalWORKS recipients. And we're really hopeful that a conversation like that can take place over the next several weeks. So thank you.
Thank you.
Yeah, Kevin Asnian, Coalition California Welfare Rights Organizations. We support increasing the grants. Right now, it's at 31% of the federal poverty level, the average grant, and that puts all families, about 1 million kids, in deep poverty. And that's severe neglect, and then they end up in foster care, and people wonder what's happening. You have to prevent it here so they won't end up there. Thank you.
Thank you.
Thank you, Mr. Chair. Frank Mecca with CWDA, and we agree with the Western Center on Law and Poverty that we hope that this proposal can be considered in the context of your earlier action to eliminate the maximum family grant rule.
Thank you. Any other public comment? Seeing none, we're moving to issue 10, Workforce Innovation and Opportunity Act, Career Pathways Trailer Bill language, Department of Social Services.
So in the federal enactment of the, we call it WIOA, Workforce Innovation and Opportunity Act, there are certain pathways created for job training and other experience. We believe that CalWORKS clients should be able to avail themselves of those same pathways just like the rest of the working population without having to be worried about whether the specific activities they're engaged in are compliant with work participation rate requirements, and this language accomplishes that intent to give them that same opportunity. No concerns have been brought to our attention on this language either.
Thank you, Department of Finance. Anything from the LEO's office? Any public comment?
Kevin Asnian, Coalition California Welfare Rights Organizations. We support the administration's proposal. That's amazing. Thank you.
Thank you. Any other public comment? We welcome the amazing. Thank you, sir. Issue number, seeing none, we're moving on to issue 11, CalWorks Welfare to Work, 24-month time clock and CalWorks services, the department.
We don't really have a proposal on this for you. It's basically an informational update on the cases. Your agenda does a really good job summarizing the issue. I'm happy to answer questions here. It's a longstanding policy in the program and obviously of continuing interest.
Anything from finance? The LAO's office. Is there public comment? Any public comment? Seeing none, we'll move on to issue 12. TANF block grant funds transfer to the California Student Aid Commission, the Department of Social Service.
Every year in the budget, after we fund the CalWorks program and establish the state maintenance of effort obligation to fully match the federal grant that we receive, we have transferred available TANF money to fund Cal grants in the Student Aid Commission as a means of alleviating general fund cost pressure in that program to make that money available for other priorities. This is a technical update as reflected in the staff recommendation as of the May revision. Because the CalWorks caseload is continuing to decline, there's a little bit more money available to be transferred. Actually, well, there's quite a bit more money available to be transferred to the Student Aid Commission, but we view this not as a policy proposal, but a technical update to the budget mechanism for these funds.
Thank you. The Department of Finance, the LAO's office. Any public comment?
Yeah, Kevin Anthony, Coalition California Welfare Rights Organizations. We oppose the transfer. This year, there's $7.1 billion available for the 1 million children living in deep poverty. The budget only spends $5.2 billion on the 1 million children living in deep poverty. $2 billion, including $1.1 billion of CalWorks money, is sort of given to Cal grants. For what reason? That money could be better used to fund the MFG, repeal, to bring grants up to the 50%, and there would be some more money, some left over. And there's another $700 million that is sort of spread around while kids live in deep poverty. I think this should stop. Thank you.
Thank you. Any other public comment? Seeing none, we're moving on to issue 13, CalFresh and able-bodied adults without dependents, the Department of Social Services.
So for a number of years, because of the state of the economy, California has had a statewide waiver that allows able-bodied adults without dependents. I'm sorry, I will get these things right. To receive CalFresh benefits and not have a work requirement or a limitation on their ability to do so. We currently expect that waiver to end December 31, 2017 or January 1 of 2018. And in preparation for that and the need to track the time that able-bodied adults with dependents are receiving CalFresh, there's money necessary to make some automation changes to the systems. There have been a lot of changes in the CalWorks program since the ABOD waiver, if you will, was first implemented 8 years ago, and the IT system needs to catch up with those to be able to reinstitute this clock.
Department of Finance, LAO's office. Public comment.
Kevin Asner, Coalition California Welfare Rights Organizations. We want to thank the department for working with us on this. This is going to happen in a couple of years, and we support the proposal. Thank you.
Thank you.
Tracy Patterson, California Food Policy Advocates. We also support this proposal. This is going to be the first time in 10 years that they're going to have to implement these complex rules, and we urge you to give funding as soon as possible so they can get up to speed.
Thank you.
Mike Carroll, Western Center on Law and Poverty. We fully support the augmentation that's being proposed in this budget. We think it's robust and we think it's absolutely appropriate. We would note and hope that the department will make sure that we meet a timeline of getting out policy recommendations and implementation matters in a timely fashion so there is no gap in benefits for ABODs and that happens in a timely fashion. I think January is the proposed date, and we would really like some assurance from the department that they'll meet that timeline.
Thank you. Any other public comment? Seeing none, we're moving on to issue 14, transfer of Commodity Supplemental Food Program from California Department of Education to DSS.
Thank you. This one is fairly straightforward. A change in the Farm Bill altered the targeted population for this program from women, infants, and children and seniors to make it solely focused on seniors. For years, this had been administered by Department of Education, and this request corresponds to a budget change proposal that we had, basically shifting that program from Department of Education to us. They have an offset to this in their budget. This is just a lateral.
Thank you, Department of Finance, the LAO's office. Any public comment? Seeing none, we'll move on to issue 15, reappropriation of funding requests.
There are a couple pieces to this one, but I'll keep it generally simple. There are a number of programs that we've been bringing up to speed and implementing in the last couple of years. The Housing Support Program is one of them. Funding for commercially sexually exploited children is another. At any rate, there are a number of programs also in the child welfare program, and also some of the money for foster parent recruitment and retention. In year one of implementation, there's a lot of development of rules and so forth, and so allocations don't always go out July 1, and then people who are using the money have difficulty spending it in the remaining months of the year. This request covers at least 6 programs, many of them relatively small, and simply ensures that the funding continues to be available for those programs as it was allocated.
Thank you, the Department of Finance. LAO's office. Public comment.
Frank Mickel with CWDA in support.
Thank you. Any other public comment? Seeing none, we're moving on to issue 16, minimum wage impacts on various programs.
With the enactment of SB 3 and planned minimum wage increases that result to that, the May revision handles and addresses across multiple programs the minimum wage increases, as the budget always has. In counties for IHSS, where the collectively bargained wage is below the minimum wage, we have raised that minimum wage in those counties, raised the wage in those counties to the minimum wage. In CalWorks, a higher minimum wage results in more earnings, which results in some grant savings. It's very small. It's roughly $6 million in the budget. And the food assistance program has that same impact if your benefits are slightly reduced by the additional earnings. So these are the technical adjustments to accommodate the minimum wage in the May revision budget.
Thank you, Department of Finance. LAO's office. Any public comment?
Very briefly, Mike Carroll again, Western Center on Law and Poverty, Mr. Chair. Obviously, this is good news. I mean, wages going up is a really good thing for everybody. We really thank the governor and this legislature for making that happen this year. It's an incredibly historic development. One thing we would point out, however, is that as we go forward in the future, the effect of these higher earnings is also going to be to push some people off the caseload earlier and faster than they currently would be. One of the things that this legislature may wish to consider is an increase in the earned income disregard going forward, which would keep people on the caseload and allow them to keep more of these earnings and reduce poverty further. So while we're really thrilled that this is happening, we acknowledge the caseload savings. We also think this is something the committee needs to continue to monitor and think about how it is that we make sure that more of these earnings trickle down to the families who need them.
Thank you. Any other public comment? Committee member questions? Mr. Harper.
Just a small comment. I would just note that one of the points that was a selling point for the minimum wage increase is that it would help eliminate some of the caseload. So I just wanted to keep that into consideration with the comments.
Thank you, sir. Thank you. Any other public comment? Seeing none, we're moving on to issue 17, caseload adjustments.
I appreciate the thoroughness that staff put together all of our caseload adjustments in all the programs in 2 pages or less. This is the caseload adjustments reflected in the May revision. Changes to the IHSS caseload are relatively small compared to the governor's budget. We're projecting SSP to be slightly slower growth than we did in the governor's budget, but still under 1%. CalWORKS we discussed already. We think it'll be declining a little bit faster than previously projected, in part because of the implementation of that minimum wage. And while the rest of the country is beginning to see a decline in its CalFresh caseload, or nationally known as the SNAP caseload, we're still continuing to do the best we can to increase our participation rate here. We've been toward the bottom of the country, and we have a whole slew of efforts that we're doing to make sure that folks are getting the benefits that they're entitled to. So continued growth in that program, albeit slower. I'll stop there and just offer questions if there are any.
Department of Finance. Anything from the LAO's office?
Jenny Bella with the Legislative Analyst's Office. We've had a chance to review the department's caseload estimates for the major programs and compare those estimates with more recent actual data, and we have no concerns with their estimates at this time.
Thank you. Committee member questions? Any public comment? Any public comment on caseload estimates? Seeing none, we're moving on to issue 18, May revision changes.
Thank you, Mr. Chair.
Thank you. Thank you. We're transitioning into issues in the Department of Child Support Services, and we'll be looking at May revision changes. We thank the Department of Social Services for handling those first 17 some issues. We look forward to a continued conversation. Thank you. We welcome the Department of Child Support Services, and we are ready whenever you are.
Thank you. Irene Briggs, Department of Child Support Services. Before I get started, I'd like to mention that there's a slight drafting error in the May revision letter. The letter references an increase to federal incentive funding when it should reference a decrease to the federal collection dollars received to the department. And the item, as it's described in the May revision letter, is correct. The budget item numbers are correct. Just the titling is incorrect.
Thank you.
I wanted to point that out. Overall, the collections for child support services are on the increase. We are projecting a $26 million increase overall compared to the governor's budget. And we're also projecting an increase of $25 million in non-assistance collections and a decrease of about $813,000 in assistance collections. And that really reflects the economy and the employment opportunities that are available to the parents that are receiving and providing benefits. So the request of the issue requesting the decrease of $407,000 for the Child Support Recovery Fund reflects the projected decrease in what we would receive to for recoupment to give back to the federal government.
Thank you. Anything from the Department of Finance, from the LAO's office? Is there any public comment? Seeing none, we thank you.
Thank you.
Thank you very much. Moving on to issue 19.
Did you miss something?
Was there something else?
There was one other item.
Please.
For state fiscal year 2016-17.
You got to jump at it when you get a chance here, because
Vicki Contreras, Deputy Director, Department of Child Support Services for the program. We have a 2015-16 Child Support Non-Custodial Parent Employment Demonstration Grant operating in Stanislaus County, and the request is to move forward the unexpended funds to forward to the next grant year to be expended in the 5th year of the grant.
Thank you. We're holding that open for now. Anything else?
No,
Thank you. Thank you very much. We're moving on to issue 19 in the area of Health and Human Services. The agency will come forward to talk to us about CalHERS and the California Office of Health Information Integrity May revision proposals. This is our final item.
Thank you, Mr. Chair. Members, my name is Matt Schuler. I'm the Deputy Director of Administration with the Office of Systems Integration, and I'm going to cover the CalHERS item. So this item is a technical adjustment to budget bill language, reducing OSI expenditure authority in alignment with a reduction in the CalHERS project budget.
Thank you. You may proceed if you have other information to present.
So that's all the information that I have on this technical adjustment, unless there's any questions.
Any committee questions? Seeing none, do you have other items to present? Anything from the department that we should hear? This is your opportunity.
So, good afternoon. members, Chair. I'm Jennifer Schwartz. I'm the Chief Counsel of the California Office of Health Information Integrity. I'm here with our Assistant Director, Elaine Skordakis. The agenda does an excellent job outlining the issue and the background. So very briefly, I just wanted to reiterate or just to go over for your information. We are seeking $800,000 in spending authority for a project that will provide statewide guidance to the private sector on the uniform understanding and, in essence, standardizing the interpretation and application of federal and state laws regarding privacy so that we can essentially achieve and support healthcare reform and integrated healthcare through increasing health outcomes by those increased sharing as well as decreased costs associated with inappropriate risk mitigation efforts that end up in overutilization of emergency room visits or essentially difficulties between the physical medicine side and the behavioral health medicine side and the mental health medicine side working together to achieve a better healthcare overround for our Californians. Any questions?
Any committee member questions? Seeing none, is there anything, thank you, from the Department of Finance, anything from the LEO's office? Is there any public comment? Seeing no public comment, we thank you.
Thank you.
I want to thank everyone for participating in today's hearing. I want to thank all of the members for their participation. I thank our budget staff for preparing such great analysis for us. And I thank the Department of Finance and the LEO's office for their participation and hanging in there for our 19 issues today. And thank you to all who gave public comment. This hearing is adjourned.